Everyone is ready? Can you see my screen?
Yes.
Okay. Okay, dear. So what you will do in the simulation patient tasks, SPT, and structured discussion. One thing is common to introduce yourself. Most important thing is introduce yourself. Never to skip this point. Once, whatever your exam, if it is yet not confirmed for overseas candidate that your exam will be physical or online. When either you enter the room or either you start an Osler online exam, you will introduce yourself, your name, first name or second name, whatever you choose, whatever you are comfortable. It will be on your tongue tip. Introduce yourself, okay? Then situation awareness. Situation awareness will be related to the patient data. Before the simulation task, before entering the room, on the door there will be data. You will be given 2-minute data timing. You will read the data. You will know about the data, about the person, name, age, complaint, examination finding. Sometime even diagnosis will be there. In the male subfertility, mostly diagnosis will be there, okay? And he will be here for his concerns to answer, okay? So situation awareness will be related to the data. You will say that, I come to know from your case note that you came here today to discuss about your result or to came here to answer your queries. Am I right? You need to call him by name in situation awareness. Then agenda, what you will do in next few minutes, in next 9 or 8 minutes, next 10 minutes. Agenda, what is your agenda? So you will tell in agenda, it should be simple, few words only, that you will tell him that I would like to ask you a few questions to know more about you. After that, I will explain you about your report, or I will explain, I will answer your all queries, and together we will make mutually agreed safe plan. Am I right? Am I clear so far now, dear girls and guys? Okay, once he will say yes, then you can start your taking information gathering by an open question about condition. Mostly, generally, you can apply one question to all. So can you tell me more about your condition? Okay, this open question can apply mostly, but sometimes you can change this open question about condition also. Then you can ask about how long you are trying to have baby. If this question is already answered in the data, then you should not ask this question. You should skip. Otherwise, you will not have enough time. Okay. So if this is mentioned data that they are been trying to have baby for the last 4 years, 5 years, 2 years, then you should not ask this question, skip this question. Then what treatment taking so far? Okay. Maybe it is mentioned also in data. Otherwise, you will ask this question. Have you ever fathered a child before? This question may also be answered already in the data, that he is a father of one baby from his previous partner. Then don't ask this question. Otherwise, this question is very important to know, maybe to know about his medical condition. Then what about your partner health? Maybe this is also mentioned in the data that female partner result and examination all came normal. Then you should not ask this question. Okay. In the general template, this is general template. Okay. General template apply mostly, but not all. 2 cases. Always be presence of mind. Don't apply all question to all cases. You will lose time. You will lose marks. You know everything, but you don't have time, so you will lose your marks. Then came at the medical history. Medical history, you will not ask All these conditions separately. You have DM, cancer, infection, genetic disorder, cystic fibrosis, but you must know that these conditions are related to male subfertility. So you will ask open question, do you have any other medical illness? If the data is pointed toward TM, diabetes mellitus, then you can ask separately, do you have any condition, any other medical condition like diabetes mellitus? If the data is pointing toward recent infection, flu, he has flu-like illness in the data, then you can ask this. If the data is providing karyotype, then you can confirm this by this. Okay. Now we will medical history. We will have surgical history. Very important, because undescended testes, hernia repair, they affect testes sperm production quality. Trauma, recent or childhood, pelvic or bladder surgery. You will not ask separately all these things in the surgical history. You will ask only, do you have any surgeries or operations before? Open question. But if you need that in the data is pointing toward or any of these things, or you think up till now that might be any of these things will be important for my management or diagnosis, then you can ask separate. Otherwise, important, only asks general. Do you have any operations before on your testes, on your male part? Then you ask sexual history. Sexual history signposting is must. Never to ask whether male or female, never to ask any sexual related question before signposting. It is very indecent to ask about how many partners you have. Do you have other partners? Very indecent. It is very indecent. How can you ask such question? Please not to do this mistake. Signposting. Humbly ask. I need to ask some personal question or question related to your sex, because always give the reason also, because it is important to know me to make a management plan for you. So you ask open question. Can you tell me more about your, do you have any problem in your sex life? Any problem in your sex life? He will open about all his problem. He will, as soon as you utter the word, any problem in your sex life, any problem in your sexual life, he will give you important information. Okay. Then you will ask about the medication. Are you using any medication? Maybe he's using any medication which is affecting the sperm quality and quantity. You can ask open question. Allergies must to ask, because allergies are related with patient safety. Okay. So dear girls, am I clear so far now? You can unmute yourself.
Yes, ma'am.
Ma'am.
Up till now, everything is clear? Sure. Okay. Allergies, very important to ask, because it is related to patient safety. Always, maybe you will give in all modules. In male subfertility, female even male subfertility, you are not giving any medicine. Maybe you will think that not to ask allergies. No, you must ask allergies. Allergies related with the patient safety. You need to ask, do you have any allergies? Okay, this is open question. Very simple, 2 word, nanosecond it will complete, but it will give you good marks. And if you forget this, you will lose patient safety. Nobody will pass if you are fail in patient safety. Social history, you must ask about smoking, alcohol, recreational drugs. All these are important for sperm production quality and quantity. Then what you do for living. Maybe he's associated with job which is related with radiation, pesticide, light exposure, or maybe he's a gym trainer, because just gym trainer related question is very important. It came in the past. Okay. So you will ask open or question what you do for your living. He will tell you. Okay. BMI, obesity is linked with the male factor. So if mostly if the patient is obese, they will mention in data that patient BMI is this. Otherwise, you can ask, do you know about your height and weight ratio? Or do you feel any recent weight changes? Okay. Please write down these sentence. Do you feel any recent weight changes? Maybe he was not obese. Suddenly, with the past few months, 3 or 4 months, suddenly he is gaining weight. Okay. So do you know about height and weight ratio? Or you can ask any recent weight changes, Then ensure confidentiality. It is a must thing to do in male subfertility case, must to do. Okay, ensure confidentiality. Mr. Smith, whatever discussed here between you and you, it will remain confidential between you and me, and not to disclose with your partner or anyone else unless you give consent. It is must to do. When to do? Either it can be do before the report, okay, or either you can do after explaining the report, or either you can do in between information gathering when you're asking about her sexual history. But you must to enter this question. Breaking bad news. Breaking bad news is an art, must to do, because breaking bad news will give you marks in communication with patient. How you break a bad news to a patient. Patient came with a report of azoospermia, and he's trying to have a baby for the past 3 to 5 years. He's very desperate. Now you are giving him news that he has no sperm in his semen. It's a very bad news for a patient. So be empathetic, very empathetic. Your voice should not be rigid, straight, no emotion. No, there must be an emotion. Should not be monotonous. While you were taking information gathering, your voice tone be different. While you are breaking bad news, your voice tone should be very different. You start confirming the report by name and HS number. Be empathetic. Inform first the normal figures, then abnormal. Give a pause. Give him some time. Then take permission to continue, whether he wants to continue the consultation or give another appointment. You can also even offer counselor. So how you will do? Mr. Smith, I can confirm this report, your name and NHS number. Mr. Smith, I'm very sorry. I don't have a good news for you. Mr. Smith, I'm very sorry. I'm bearer of this news. Report shows that your semen has no sperm. Give a pause. He will say, what doctor, what? Mr. Smith, I'm very sorry. This report has been confirmed by two embryologists. Mr. Smith, I know this news came as a shock to you. Do you want me to continue this consultation? Or do you want some time to be with you in another room? Or do you want another appointment? Mr. Smith, do you want to continue this consultation? Okay, girls. You understand breaking bad news? Unmute yourself. Understand
Yes,
breaking
ma'am.
bad news?
Yes,
Breaking
ma'am.
bad news?
Excellent. Yes, ma'am.
Understood.
You notice the voice I change? It's very easy. Acting
Okay.
is must thing. Always keep in your mind, acting is must to pass RCOG. Because it is not a negative thing, acting. Because if you know someone is speaking you nicely, you feel good. If someone is feeling your sadness, and someone you feel very pampered, covered, you feel at least you feel some support. How can you be aware? How can you give a bad news a person with a very, Mr. Smith, your report shows that there is no sperm in the semen. Do you want me to do you want another consultation, or you want me to continue? Mr. Smith, is this shows that there is a very low count? No. How can you say that? Your voice shows that empathy. Empathy is very important. If you do this breaking bad news in a good way, you will pass in communication with the patient, and he will immediately move on. Otherwise, he may show some resistance, he may say why, and maybe start crying. In physical exam it's happened like that. Even breaking bad news, you can, in physical exam you can offer tissue paper or glass of water if they are present in the on the table. Okay, breaking bad news, please to be practice, speak, perform with your study partner, alone, in front of mirror, or with your mentor in our group, okay. Explain why this happened. Of course, next question he will ask you, but why this, doctor? Why this to me? I am perfectly normal, why this happened to me? Mr. Smith, again you can show some empathy words, huh? Mr. Smith, I can see that you are in much agony, and I can see this shock. This news is a shock. It is understandable. Most of the time, there is no cause. Sometimes it is related to medical condition. Some hormonal disbalance also can cause this no sperm production. Sometimes some drugs, smoking, excessive alcohol also can affect sperm production. Some birth defects, sometimes infections. Am I clear so far, Mr. Smith? He will say yes, yes. Empathy, I'll explain. This is the general. You can apply in every subfertility case, all these things. Most of the time, no cause, medical, hormonal, smoking, alcohol, birth defects. Okay, this is general. You can apply this. Then he said, so doctor, what will happen to me? I mean, I cannot have baby at all. Mr. Smith, there are some good treatment options for you. These options start with lifestyle modification. If he smokes, then you can mention quit smoking. Okay, if he's not smoking at all, how you will mention. If excessive alcohol, 1 or 2 shot of alcohol, or occasional smoking or occasional alcohol has no is not evidence based to interfere with sperm production. Okay, please be careful about it. If he admit that he is using some steroid, then you mention this in lifestyle modification. Balanced diet and sleep, intake of vitamin, coenzyme, Q10, zinc. However, all these will apply in lifestyle. Better to mention lifestyle modification first. Okay, then treatment option, lifestyle modification. Then there are some good treatment options. This is general. Okay, then we can have baby by test tube baby. We call it IVF or ICSI. Okay, this is for oligospermia, when count is low. When azoospermia, when there is no sperm. This is general. Okay, general treatment options. Okay, you have to select according to data, according to your case. When azoospermia, you can, Mrs. Smith, if there is no sperm in the semen, then you can tell Mr. Smith, as there is no sperm in your semen, but however, there is chance that we can take out sperm from the deeper tissue of testes by a special doctor called as andrologist. We can do this by numbing the skin over the testes or making you completely sleep. Once he picked the sperm, one or few sperm will be analyzed by another specialist doctor called as embryologist. They will pick the sperm and can use to have test tube baby by involving your partner egg. For this, we will involve fertility specialist doctor. At every step, we will involve you for decision making. There is very good hope for those who have no sperm or low count of sperm. Okay, so this is general. You will pick you will not supposed to explain these terms in SPT, none of these. Okay, and later on with the case, I will tell you how to explain these all terms together with simple words and sentence in cases where you need to take out sperm from the testes. Okay, this is all applied knowledge you already know from your part 2. This is MESA and PISA, also applied to applied knowledge. which is MESA and PISA in obstetric case and cystic fibrosis. Am I clear so far, girls?
Doctor, can I ask you one question, please?
Questions will be okay.
Yeah, about examination, in case we need
Okay,
examination.
okay.
Yeah,
I will inform you after information gathering once finished.
Okay.
Okay. Hormone. I am sure hormone analysis in male subfertility. This is not required. Dear girls, I'm trying to give you as much as simple, correct, easy pathway to pass part 3. No need to go in extra detail. Once you pass part 3, go in extra detail. Read as much as you want. But here you all are together. Overseas candidates, it is very difficult to pass exam for not belonging to our system. Don't make things difficult for you. Okay, I will make you a simple way. Follow my path. Okay, try to understand me. This hormone analysis in male subfertility. Sorry, nobody will ask you anything. This is all applied knowledge. These are given in data. 99% all, if you open all your past papers question, these data is given. It is already I mentioned here only for your knowledge. Severe oligo or azoospermia will go to check FSH, LH, and testosterone. Okay, if normal, if this FSH, LH is normal, then why oligoazo? Then we'll check for post ejaculatory urine analysis. Maybe semen is ejaculated on the wrong pathway. Okay, to exclude, we will do a urine analysis. Okay, if sperm not found, even in that urine analysis there is no sperm, it may be obstruction. Okay, so it is a case of obstructive azoospermia or impaired spermatogenesis. There is no sperm at all. Then if the FSH, LH is low, maybe it is hypogonadism. Okay, if FSH, LH is high and low testosterone, it means there is testicular failure. Anterior pituitary is giving signals, but testes is failed to produce testosterone. If low sperm count, low FSH, LH, maybe steroid intake. Okay, then if low testosterone, reduced libido, it will be prolactin. Most of the cases we have related with this condition. Okay, okay, now I will answer the question of examination. Up till now they never ask about examination. Okay, this is the very accurate answer I'm giving you. Nobody will ask you examination in the male subfertility. Already giving you examination. If not mentioned in data, you are not supposed to do. Subfertility doctors are not supposed to do male examination, male part examination. They are special. They are separate doctors, andrologist, who will do exam. Okay, and even in exam, no need for examination. Already examination is done. No need to mention examination. We'll do examination for you. Will check your BP, pulse, temperature, like that. No need to do like that. Any question? Any questions so far? Please unmute yourself. Don't hesitate. Any stupid question. Any stupid question. Don't hesitate. If you hesitate now, you will hesitate in the exam. Don't hesitate in the exam. Better hesitate here. Okay. Please ask question.
Doctor,
Otherwise, I will ask. Yes, please.
about sperm biopsy, usually in the infertility clinic, you mean they will do it?
Yes, sperm biopsy will be done in case of azoospermia. Okay, when there is no sperm coming in the semen, we will take sperm from the tissue of testis. This will be done by male. You will not do this. You will refer this case to andrologists and embryologists. That's it. This is enough answer for part 3 syllabus. Okay.
Yeah. That local anesthesia usually.
Yes, local anesthesia or maybe local anesthesia or maybe, but in case of MTs for non-obstructive causes, they are doing in under general anesthesia. So not to mention separately. You can mention by numbing the skin over the testes or completely sleep, whatever suitable for you. Okay.
Yeah.
Hello, I'm Dr. Mahwish, Dr. Hana here. Can I ask 2 questions from you?
Yes, sure.
Okay, Dr. Mahwish, my first question is if the azoospermia is because of this anabolic steroids, after how long we will repeat this semen analysis?
It will not depend upon anabolic steroid. Is semen analysis repeat is given by guideline. By guideline says it's severe oligospermia or azoospermia, you have to repeat immediately. And if it's oligospermia, you will repeat in 3 months. Okay, you will always follow guideline. Guidelines say it's severe immediately. If oligo, we will repeat after 3 months. So for anabolic, you can repeat after 3 months. Okay, but I have a good case related to your question, and I hope I will also answer your all queries in that case. Any other question?
Second question is for this male infertility station also, like if azoospermia or even oligospermia comes, then even we have to show confidentiality in the start or no? Mention should we have to mention it, or I don't think so we have to mention confidentiality.
If he's along with his female partner, okay, if he's along with the female partner, then it means he's quite comfortable. He came to know about his report with his female partner, so no need confidentiality with the partner. However, you may need to confidential with other maybe other colleagues. He don't want to disclose with the GP also. GP is his friend. And female partners mostly. Okay, so mostly they are coming alone because in exam they want to check you this to check that you will touch this point or not. Okay.
Right. So can you please summarize that if he is alone, will we show
in the case I will
confidentiality, and
answer.
how
Yes, it will be discussed in the case. Case is
right,
coming.
right, okay,
Case is coming.
right.
Better I will start case 1. I think all your and other colleagues concerns will be answered by the case.
Right.
Am I right?
Thank
Right?
you.
So I will
Right, okay.
start case 1. Who would like to present this case 1? Who would like to?
Hello. Yes, I can present.
Please introduce yourself.
Okay. I'm Sabine, and I'm giving this exam second time. And yes, I'm in Pakistan at the moment.
Okay, Dr. Sabine, you have this case with me. This is SPT, and you have 2 minutes to read the data. Okay, I will set timer for you. 2 minutes. Once 2 minutes finish, you will enter the cubicle.
Okay.
Then you have 10 minutes. Okay, so I will put timer for you now. I will put timer. You are ready for data? 2 minutes.
Yes, I need to read the case. So with the timer, right?
Yes, I will start your data timing. Start data timing.
Okay.
Okay, your time is finished. Enter in the cubicle.
Hello, this is Dr. Musarat, one of the doctors in infertility clinic today. May I know your full name and date of birth, please?
I am Smith. I am 40 years old.
Okay, thank you. How would you like me to address you?
You can call me Smith.
Mhm. Okay, and you can call me Sabine in the whole conversation. If you feel at any time, you can stop me. Okay. So Smith, Smith, I came to know about your results and about today's consultation that you are here to discuss about your results, which has recently been done. Is it okay?
Yes.
Is it? Mhm.
Yes, doctor.
So, so I'm here to discuss more details about the results and about your concerns. So, may I know your specific concerns for today's consultation?
Yes, doctor. I like to know about what happened to me and what I will do. Any treatment for me. And I'm really upset that doctor told me that I cannot be a father. How? It is very unbearable for me. Please tell me what are the treatment, medicine, anything for me.
Yes, it is. I understand, Smith. It's really a shocking news, and at this moment, it's really unbearable for you. But as I'm new and I'm seeing you first time, I'm here to discuss with you in detail, and I would like to address all of your concerns. But before that, is it okay if I will ask you few general questions related to your general health? Would that be okay for you?
Yes, please, doctor. Yes, you can.
And Smith, are you alone here, or you want somebody to be with you, like your partner
No.
or someone else?
No, doctor. I don't like anyone to came here. I want to discuss with you alone.
Okay, all right. So as you said me that what do you know exactly about your results? You said that doctor already discussed the results with you, right?
They told me that there is no sperm in the semen.
Okay, and is it first time this your semen analysis has been done, or it has been done twice?
No, it is done first time.
Okay, all right. So let's come to this result little later. First, I will ask you a few questions. So, Mr. Smith, how is your general health overall?
Yeah, I'm fine. Okay, but sometimes I'm feeling tired, and I'm recently gained a lot of weight.
Okay, all right. And like during and any other complaints besides this weight gain and tiredness?
No, it's okay. Fine.
And may I ask, have you ever fathered before?
No, doctor.
Okay. And do you have any long-term medical condition which I should be aware of?
No.
Are you on any particular medications?
No.
How about any any steroids or any other over-the-counter medications?
No.
Have you ever had any operation, any surgery down below or in your back?
No.
Any accidents by any chance, Smith?
No, doctor.
Okay. And are you allergic to any medications or any other food item?
No.
Okay. And how is your partner's health overall?
Yeah, my partner is all lab investigation, all everything. She's fine, perfectly fine.
Okay, all right. And as you told me that this test has been done first time, right?
Yeah.
Okay, so Smith, few more questions related to your lifestyle. Do you smoke?
Yeah, occasionally.
Okay, and do you do any exercises, any heavy exercises, I mean?
No.
All right. And how about any alcohol and any other drinking habits?
No.
Okay, all right. And in your family, anyone has any similar condition or any diabetes?
Similar condition? What similar condition, doctor?
I mean any like unable to conceive or any subfertility issues.
No,
Okay.
no.
And how about any diabetes in family? I mean, in your first family members?
I'm not sure, doctor. I'm adopted child and I don't know about.
Okay. Thank you for this information, Smith. And now I will discuss the results with you. As you already know that this is your semen analysis has come as azoospermia. Have you ever heard this term before?
Yeah, my doctor told me that that it means that no sperm in the semen.
Yeah. So azoospermia means that no sperms in semen, and sadly, it's that I'm sorry that I am the bearer to reveal this report to you, though you knew it before. But there are options to discuss to deal with it, and for that I might refer you to some infertility specialist. But before that, I would like to discuss the other results as well. Besides this semen report, your hormones, which are egg making, they are also very high. It shows that your testes are not working in working order. Are you getting me, Smith?
Yes, doctor.
And one more thing is, Smith, that your hemoglobin A1C is very high. Do you know what is it?
No, I don't know, doctor.
This means that you are having diabetes.
No, diabetes. But how come I can have?
Yes.
I don't.
Smith,
So what I will do?
This hemoglobin A1C basically, I will refer you to diabetologist. They are a specialist. They will deal with your sugar levels and they will put you on medications, because it could be a contributing factor towards poor semen report, and you need to reduce your weight. For that, I will also refer you to dietitian, and they will advise you how to control the diabetes. It is very important for your general health as well as this concern. Are you getting me, Smith?
Yes, doctor.
Yeah. And besides that, there are, as you met the consultant and they advised you for some specific treatments for this azoospermia. Do you know actually this as you know that there are no sperms in semen, so the next step would be little invasive. And do you want me to discuss all the further steps, or
Doctor,
how would you like to?
Doctor, we were desperately finding a way to have baby. I'm really upset about this.
Yeah.
The doctor told me before, and now you are telling me. I just want to know what I can do. Do you have any medicine for me so
Yes,
I can have a baby?
Smith, at this time, actually, there are further visits. We might need your wife along with you also, your partner along with you as well, to have a detailed consultation with our infertility specialist, because there are options. As I told you, there are surgical options. Actually, there are no such medications to get sperms back in your semen. We have to repeat test again very soon. And then if the repeated test will be same, then we would offer you some surgical techniques. These are mini surgeries, like they will try to extract sperms from your testes. Are you getting me, Smith? And then and then tell me.
So doctor, can I use Viagra? I think it will be good for me. Maybe it will help me to get a sperm in my semen.
Viagra is for sorry, I did not ask a question. Do you have any difficulty in your like sexual life, in intercourse?
Yes, sometimes I have
What kind?
No desire to have sexual intercourse, and sometimes I really get into sex. I have some difficulty. Like
do you have any difficulty in ejaculation or erections?
Yeah, yeah.
So, Smith, Viagra is not at the moment the right thing. These problems could be because of your high hemoglobin A1C, your diabetes. First, we need to control your diabetes. Along with that, I will refer you to the specialist, and they can only advise you about Viagra. Are you getting me? Because that can improve your sexual design and all that, but to control diabetes is really first our priority.
Okay. So, doctor, I want to know that do you everything you will tell to my partner?
Smith, this is the
Time
treatment
finish.
for both of
Time
you, but
finish. Okay. Continue, but time finish. Continue for 30 seconds more, but time is finished.
okay, thank you. But the thing is that I cannot inform your partner unless it is permitted by you, because it's quite confidential between you and me, whatever we conversated today.
Okay. Thank you, sir. Thank you,
Thank
sir.
you.
Thank you very much, Dr. Sabine. Very good try.
Yes.
Very nice. Well done. You took 5 minutes to complete your information gathering. This is too much far to pass this station. Anything in between 3 to 4 minutes is acceptable. Anything beyond 4 minutes will make
Okay.
you more near to fail.
Yeah.
Whatever you do, practice whatever you do. Cut your sentence, cut your words. Whatever you will do, try to finish in 3 minutes or 4 minutes maximum is 4 minutes, otherwise you will fail. You will unable to complete the station, you will unable to give the diagnosis, unable to give the management, unable to answer his question. I ask you very few questions, I give you more time to complete the case, but it cannot happen in the real exam. They will maybe will ask you question, then you miss almost confidentiality, which I told you while explaining general template. This is a must to do. When there were only few seconds remaining, then that time I asked you about the confidentiality because you are missing out. Okay, so please
Yeah.
don't miss this. Okay, now I will start from the beginning. You entered in the cubicle, you introduce yourself. Okay, you give your name, but you took more time to introduce yourself and ask the name. You will ask you ask his name, then ask how may I address you, then you said you can call me this. No, you are killing your time.
Okay.
You just simply said, please dear girls, enter the cubicle or start your station in the oscillator. Both things. Hello, I'm Dr. Sabine, one of the doctors in the fertility clinic. Can I confirm your name, your age? How would you like me to call you in that case when there is mostly they are giving very simple names. Sometimes they are difficult names. Sometimes two names given. Okay. In that case, ask them what they would like to call. If only Smith is given, if Smith is so simple in one name, how would you like me to talk? You are wasting your time. Okay. Only ask this question when there is difficult name or there are two names given. Okay, so then how would you like me to not to use word address, how would you like me to call you? Okay, then you start with the report. You took time. Situation awareness, your situation awareness was too long. Mr. Smith, I come to know from your case note that a semen test has been done and report has been informed you as no sperm in the semen. And today you came here to ask some of your queries. Am I right? He will say yes. Use simple word as much as possible. Make sentences of your own. It's not much that you will use my sentences. You can make your, but the idea is to make crisp, clear, simple, to save time. Okay, finish this. So, Mr. Smith, is this okay? I will ask you a few questions to know more about you. And together we'll make, and then I will answer you queries because he came to answer his concern. You can see here, queries. I will answer all your queries. And after that, together we will make mutually agreed safe plan for you. Is this okay, Mr. Smith? Yes, Mr. Smith will say. Then again, you ask about medication, surgery, okay, allergy, okay, good, very good. You ask about the partner health. Partner health, is already given here. Female, all result now. No need to ask this question again. You can address only. And I can see from your case note that your partner result came as normal. Am I right, Mr. Smith? He will say yes. It shows that you have good presence of mind and you have read the data well, and you are, the thing is already given and you are asking him why you are asking him. Okay, so you no need to ask him. Then you ask for smoking, recreational alcohol. Okay, then you this is not a breaking bad news because he already knows. He already know about his result. Couple has discussed all the result. Okay, so breaking bad, this is not a clear breaking bad news, but still you have to be very empathetic, soft, low voice, no monotonous voice, no rigid tone. You ask, Mrs. Smith, and you said, Dr. Sabine, you said, Mr. Smith, you have no sperm. No, it is not like that. Okay, please be careful about this. Be empathetic, otherwise you will lose marks in your communication with the patient. If this case with this case with lay examiner will fail you. Okay, so please take care for this when you come to either you are addressing here, you are addressing only, you are not disclosing his report, you are addressing, Mr. Smith, as your report came as no sperm in this pill. Anybody has told you, explain you about this? He will say yes. Okay, say okay. Then you discuss about HbA1c, diabetes mellitus, involved diabetes mellitus, doctor, very good. Then you went for invasive procedures. Okay, that was good, very good. But you did not confirm his name and NHS number on his. Okay, no problem. All result has already informed, but you were unable to finish the station. Finishing the station is very important. With once you start after the diagnosis, you will answer his queries. You will inform him about the treatment option with lifestyle modification and his treatment option related to the HbA1c, then related to azoospermia. Then few general tips for, I will give you some written information. I will attach to you, Counsellor, because I think it is understandable that you are going through a tough time. Again, empathy. That patient will be very happy with Dr. Sabine if Dr. Sabine will be more empathetic with the patient. Otherwise, he will go straight forward. Maybe he will complain for you. There's a there's system. Otherwise, he will go to your consultant. Maybe a consultant will have already too much patient in his outpatient department. So how he will handle more patient from Dr. Sabine's side? Okay, be empathetic. So they have crowded OPTs. They like to see, NHS like to see doctors who can handle with patient safety, with applied knowledge, very empathetically, giving good acting nicely the patient. Okay, so after the general point, you can finish the case. Overall, it is a very good attempt, but try to reduce time of information gathering. If you have enough time, you can, otherwise it was perfect. I would like the one who said in the beginning of the session, PHU, that said she's first timer. I'd like to listen from her. PHU, can you kindly unmute yourself and came here, please? I'd like to listen from you, dear. Please don't afraid. Come.
Me?
Yes, PHU. You are PHU?
Sorry?
Your name was, your first time? You're beginner?
Yes.
Yes, okay. Can you, would you like to do this case?
Of course.
Very good. So you have enough, already you have read this data. So can I start from the 10 minutes?
Yes.
Okay, are you ready?
Okay.
Okay, ready? No, please close your books. Don't look at the books and pages, otherwise it will distract you.
Okay.
Act like you are in your clinic and patient came here. Be simple. There is,
okay.
It's a very simple exam. We complicate this exam.
Okay.
So I will start. Okay, start,
Yes,
dear.
yes.
Start.
Good morning. I'm Dr. Poo, one of the doctors from this infertility clinic. How may I address you?
I am Mr. Smith.
Hi, Mr. Smith. I
Hi,
understand that
doctor.
you came here today to discuss about your investigations, right?
Yes.
So before consultation about your investigations, I would like to ask you a few questions to know more about you. Would that be okay?
Yes.
Okay. How long have you been trying to have a baby?
Yes, doctor. We both are trying to have baby about it's about 3 to 4 years.
Okay. What treatment have been taken so far?
No treatment has been done. Just recently we did some investigation, and my partner results came as normal. But
Okay.
doctor told me that I have no sperm in my semen. I'm so upset about this.
Have you tested your semen once or twice?
Yes, it was tested once.
Okay. Okay, would you mind if I ask you a few questions about your underlying medical condition? Do you have any underlying medical conditions like hypertension, diabetes, or cancer?
No.
Is there any underlying genetic or is this going to need a genetic disorder do you have?
No.
Okay, have you been suffering from any recent flu-like illness or some fever?
No, doctor.
Okay. Do you have any? Have you undertaken any surgery before?
No, doctor.
Okay. Would you mind if I ask you a few personal questions because it is important and it influence for your management? Would that be okay?
Okay. Okay.
Do you have any problem during having intercourse, like erection problem or ejaculation problem?
Yeah, doctor. I have very less desire to do sex, and sometimes have really difficulty in both. I really have difficulty in doing sex.
Okay, I'm sorry to hear that. Are you taking any medication?
No.
Do you have any allergy?
No.
Do you smoke?
Occasionally.
Do you drink?
Occasionally.
Okay. Are you taking some recreational drugs so far?
No. No, not at all.
Okay. What do you do for a living?
Doctor, I'm a receptionist.
Okay. Have you noticed any recent changes in your weight?
Yeah, in the past 3 months, I feel that I'm gaining weight.
Okay. So before explaining about your investigation result, I would like to explain you that whatever discussed in this consultation will be just between you and me, and it will not be disclosed to anyone, even your partner. Are you following me?
Yeah, doctor. Okay.
Okay. Okay. According to your report, it is confirmed by your name and the NHS number. I'm sorry to say that the information given in this report reveal that there is no sperm in your semen. I understand that you have told by your previous doctor, right?
Yeah.
Okay. So we need to confirm this result twice because it can be confirmed by only one investigation. And I'm very sorry to say that. Do you have any other question?
Yeah, doctor, I like to have some medicine to solve this problem. I really like to have babies. And doctor, she says something about some. I don't know about these methods. I want to have baby. Just tell me,
Okay.
how can I have baby?
Yeah, I will explain more about it. According to your investigation result, this could not be solved by taking medications. So I will explain you about the management, treatment, ongoing treatment. Do you want to hear me?
Yes. Okay.
Okay. According to your history, your investigation has just performed once. So we will repeat the investigation again. If the repeated results also reveal the same, this condition cannot be solved by taking medication, and you can have a test tube baby by extracting your sperm from your testes. Are you following me?
Yes. Okay, doctor.
Before, I would like to refer you to the IVF center to undergo these procedures. Would that be okay?
Okay. Okay.
Do you have any other questions?
Doctor, can I use Viagra? I heard that it will be good for sperm.
Sorry?
Can I use Viagra?
Regarding to your investigation results, it showed that you have high hemoglobin A1C. It could be due to you have underlying medical problem like diabetes. So your sexual problem like loss of ejaculation and erection could be due to this, due to diabetes. So you would the first priority is you need to control your diabetes. So I would like to refer you to an endocrinologist to control your diabetes. Would that be okay?
Okay, doctor.
Do you have and another thing is you should modify your lifestyle, like do a regular exercise and take eating balanced diet, and I would prescribe you some medication to enhance your semen quality and your living, like coenzyme Q and zinc and omega-3 like medication. Am I clear so far?
Yes, doctor. Okay.
So do you have any other questions?
Okay, doctor. So with this help, this healthy diet will help me.
Sorry?
So, doctor, this healthy diet will help me. No other medicine for me.
Yes. You told me I would like to prescribe you some medications like coenzyme Q-GEM. I said it earlier. It would enhance your semen quality and your well-being. Am I clear so far? Okay.
Okay. Okay, doctor.
If you have, do you have any other question?
Doctor, I'm feeling so fatigued sometimes, and
Yeah. I'm sorry to say that. I'm sorry to hear that. I mentioned to you earlier that your fatigue and your sexual problem could be due to your high hemoglobin A1C. It could be due to underlying diabetes. So I would like to refer you to an endocrinologist for this condition. Am I clear so far?
Okay, doctor.
Okay, thank you.
Thank you, doctor. Okay, you have still 52 seconds. Okay, but you
Yes.
finish your. Okay, it's a good attempt. Very nice attempt, Fu. I'm sorry if I pronounce your name wrongly. Please forgive me.
That's right.
Okay, so Fu, it's a good attempt.
I couldn't maintain this 10-minute discussion. It's my bad.
Yeah, you took 5 minutes in information gathering. You need to reduce this time by making practice. You need some practice, otherwise it's a very good attempt, and your speed is okay, your voice accent is okay. It's not it's for beginner, it's very good, but you need to practice more to overcome your some like behind things. Okay, otherwise it's a good attempt. So you took 5 minutes information gathering. You did intro, medical, surgical. You signpost very nicely, and
Yes.
you involve in the management diabetes doctor. Then you give
Yeah.
lifestyle modification. Okay, it's a nice attempt. Continue practicing will improve you a lot. Okay, wish you best of luck. So
Yes, thank you.
now I would like to go to keys for case 1. Okay, introduction. Introduce yourself, give your name quickly, ask his name quickly. Who you forget to ask his age. Okay, never to skip asking name or age of the patient. This is patient safety. Okay. Situation awareness. So Mr. Smith, I come to know from your case notes that you couple have been trying to have baby for this. You and your partner undergone some tests, and today you came to discuss about your result. Am I right, Mr. Smith? Do you know about your result? Is this okay? I will ask you a few questions to know about you. Then I will answer all your concerns, and together we will make mutually agreed safe plan for you. Then you will follow general template. Okay, please save this slide. You can take screenshots. Okay, I will move. General template, you will start with open question. Mrs. Smith, can you tell me more about your condition? How long you tried, father, child, if not mention the data? Have you ever taken any treatment taken so far? Then you will take medical history. Any medication, any illness you have, any family history you have, any medication you are taking, allergies, surgical history, and what you do for living, very important. You can ask about the symptoms of diabetes if he already not diagnosed. And you need to ask about this very important question. Then sexual history, signposting. I may need to ask you some personal question related to your sexual life because it will help me to understand the situation. Mr. Smith, can you tell me more about your sexual life? Open question. He will tell you about erection, ejaculation, libido, sex frequency, any problem. Ask about his recent change in weight or height to weight ratio. Ask about smoking or alcohol. Explain about the report, but as in this case, report is already informed. So he already knows the result. But with empathy, you will that it is understandable, Mr. Smith, that you are going through a tough time. Your report of semen came as no sperm. Does anyone explain you about this? Maybe he has no clear idea. Sometimes this happen in exams. They're testing. You must know about the background, or this is called as to check the background knowledge of the patient. Maybe he knows everything about his case. He already studied in the internet. Okay, so you need to check about the background knowledge. Ensure confidentiality. Mr. Smith, whatever discussed here will remain confidential between you and me, and not to disclose to your partner unless you give permission for it. Okay, these simple words, small sentences will save time, gain good marks. Please save this. Immediately we'll ask why this happened. Mr. Smith, sometimes there will be no cause, sometimes birth defects, some hormonal imbalance, sometimes some medical illness like diabetes. In your case, it can be the reason, one of the reasons, as one of the results showing high sugar levels in your blood. However, need to confirm by one reading, you cannot say like that, okay? However, need to confirm by diabetes specialist doctor. For this, I will refer you to diabetes mellitus doctor, diabetes specialist doctor. Clear? I may need exam and further checkup. For this, I will refer you andrologist doctor. He's the doctor who knows male part and their illnesses well. Am I clear so far? Physical exam, checkup, not for subfertility, ST5, not for us. It's for andrologist, separate andrologist. You must to mention andrologist doctor only because it will give you marks for communication with colleagues. Reassurance. Mr. Smith, once your sugar levels in blood is good control, your sperm production can be restored and can be confirmed by semen test. Am I clear so far? You ask his background knowledge about his report. He said, yes, I know, no sperm. You explain about the why. Then you refer him to diabetes because HbA1c is high. Immediately you give a cure. Then you reassure that sugar levels will be controlled, and it can be controlled because it can be one of the reasons. Maybe there are other reasons also. But there is no perfect diagnosis in one station without physical and further confirmation of the diabetes. Okay, so reassurance you have given. But what happened? What if there is still he will remain azoospermic? Maybe diabetic is not the only one cause. Maybe some other causes. In cases, go on the safe side. Okay, so you will say, Mr. Smith, even then, if still no sperm appearing in semen, in that case, you can offer you test tube baby. For this, a special andrologist doctor can pick few sperms from your testes tissue by needle making complete sleeve or by numbing your testis skin, whatever the situation best for you. Because most of the cases, few sperm will be present in deeper tissue, even if they are not appearing in semen. Okay, you explain the condition. How can this, how a doctor is taking sperm and sperm not coming in semen? Layman, he don't know anything about the methods. Once he picks sperm, then another specialist doctor called as embryologist will start working for test tube baby. Am I clear so far? Always ask this question, not to forget. Give knowledge in chunks. You explain once before you give reassurance about diabetes. Once it will be controlled, you will have, maybe it will be the reason. You are not sure. Maybe it will be the reason, you will be cured. If not the reason, we have this option also. Second reassurance. Pre-implantation gestational diagnosis is important in non-obstetric type of where the genetic illnesses and where ICSI is involved. I mentioned here sometime according to data. It is important to mention this. Mr. Smith, by test tube baby, there is a small chance to transfer birth defects. To avoid this, we will involve a genetic specialist doctor. Will thoroughly look before implantation of baby. In each step, we will involve you in decision making. He is the one who will decide. Maybe he will refuse for this T's and T's, pizza, mesa techniques. He don't like. Maybe he belong to his ethical values not allow him for test tube baby. Give this sentence also. This not necessary, but you must keep in mind there is a thing PGD. This is patient safety. After ICSI, he has abnormal baby, so he will sue to the NHS. So this is PGD. We will inform that there is chance, but we will involve. Always give. There is a chance of some problem, then always give him a cure. You give cure, genetic specialist doctor, so he will not be afraid. You are not here to scare the patient. He will straightforwardly told you, doctor, you are scaring me. Doctor, I'm so scared. But the time he said, doctor, I'm so scared. You are scaring me. It means you miss something. You miss reassurance. Reassurance by communication with colleague or by correct applied knowledge. Okay, simple sentence, simple words. Genetic specialist doctor, you gain marks for communication with colleague here, and here embryologist is involved, andrologist is involved. Can I use Viagra? Both of the answer from Dr. Sabine and Dr. Poo were right. Mr. Smith, Viagra might not be a very good option for you. Once your diabetes in good control, you may find your sexual health improving a lot. Viagra efficacy is not confirmed for sperm production and evidence-based. Therefore, I cannot recommend it for you. You did not refuse and you did not accept. We cannot recommend only one herbal or one medicine which is not evidence-based. Follow RCOG guideline. There is never mentioned Viagra in RCOG guideline. Okay, girls. Can I proceed to case 2? Any question regarding case 1 before?
Yeah, Dr. Just I want to ask you one question. What do you mean by andrologist? Do you mean endocrinologist, or do you mean it is fertility specialist?
No. Okay, very good question. Good. These embryologists, doctors, what's your name, doctor?
Anam.
Anna?
Anam.
Enam. Dr. Enam. Dr. Enam, when sperms are taken from the testes, these sperms sometimes they are not in good motility. They are morphologically abnormal. Those doctors who look for the sperm, who pick sperms for having good motility, good morphology, these are the doctors who knows about. These are the doctors who do semen analysis. They have knowledge about sperms and eggs. They are the embryologist doctor. In IVF ICSI, there must be a embryologist doctor involved.
Yeah.
Because I will not see the sperm motility, okay?
Yeah.
Or morphology. And the andrologist doctor will not see. He has no knowledge. This is the one who will pick the best sperm. When in XT, you have to select the one sperm. Best, the one who motility is fine up to the WHO range. Morphology up to the WHO range. He has the knowledge, okay? Which is the embryologist doctor.
Yeah.
Any other question?
Yeah, I get it. So when the embryologist doctor asks your patient, hello?
Excuse me, Dr. Mahwish.
Yes.
I have one question. In this scenario, we already know that he has informed about his report that it's azoospermia.
Yes.
He has not been informed about azoospermia, and like in this scenario where there is testicular failure, LH and FSH are very high, how we can explain to the patient?
Explain.
Like the condition of testicular failure, just like in this scenario.
First of all, you know, they give you always simple case, okay? They know that it is 10-minute exam. Try to understand my answer, okay? RCG will give you a scenario which can be easily and sufficiently covered in 10 minutes, okay? They will not give you a scenario which have many points which have to covered from multiple direction, okay? So in this case, you can see the case, this is a recall case that he already knows. He already knows the result, and you ask his understanding. Does anybody explain you about this result? Yes, doctor, I know. Finish. He knows. No need to explain everything. You got my point? He knows everything. You ask his understanding. You ask his understanding more in points even. You can. Do you know that some of the hormone levels are high? You have no sperm in semen, and you have some of the male hormones high in your blood. Do you know about this? He will say, yes, I know. Finish. He knows. When he knows, then do you know? He knows. If he said he knows, no need to explain further. You got my point? This station, they are telling that he came for his concern. He has some concerns regarding T's, C, confidentiality. He like to be assured about future fertility plans. Okay. Okay. If he don't know, okay, no problem. If he don't know, how we will explain? We will explain. We will confirm the report, NHS number, his name, breaking that scenario. I'm very sorry to. I'm the bearer of this news, Mr. Smith. I'm very sorry to explain you that there is no sperm found in your semen. Mr. Smith, are you following me? Mr. Smith, there is one more blood test who are giving information about some hormone which are important for sperm production. They are found to be very high, which means that your testes or gonad stop working. Am I clear so far? You got my Do you have any questions so far, Mr. Smith? Okay, Dr. Na, got my point?
Yes,
If
Dr.
he
Mahwish.
knows,
Yes, got my
no need to explain more. Data is very important.
Ma'am, I have
Okay.
a
Another question?
Yes, ma'am. I'm Dr. Shiba, ma'am. Good evening, ma'am. Hello.
Yes, Dr. Shiva.
Ma'am, here in the information gathering,
Yes.
the Smith has expressed that he has put on weight and he has decreased libido
Yes.
and with azoospermia.
Yes.
And do we require to do any further investigations to rule out like hypothyroidism in this case if they are not asking self?
Your voice is very unclear and shaky, Dr. Shiva. However,
Can
I
you hear me,
understand
ma'am, now?
that there is HbA1c mentioned in the data. You will not go for thyroid. He already exclude that he has no problem. Okay.
Okay, ma'am. Okay.
HbA1c.
Thank you.
HbA1c is direct to all. Please. Yes, of course. A man can have multiple illness.
Yes,
But we cannot discuss in 10 minutes. Always keep in mind that you are in 10-minute exam. Okay. Go with the data.
Madam. So we
Go in
have to
so-
focus
and we
only
are-
on the concerns related
Data, yes.
to others.
And you are not giving him, I told you, you are not giving him confirmed diagnosis. Maybe diabetes. We will refer
Yes,
you for
ma'am.
diabetes specialist doctor. Maybe some other reason. For this, we
Yes,
can
ma'am.
offer you IVF. You see? Okay. You are on
Yes,
safe side. There is nothing confirmed here.
Okay.
You involve the doctor's treatment according to data, and that's
Okay. Okay, ma'am. Thank you.
any question. I will move to case 2.
Can I ask one question,
Yes,
please?
yes, please.
Yeah. So management plan, we can explain
Introduce
about
yourself,
that.
please. Introduce yourself, please.
Yeah, I'm Salma.
Salma. Okay,
Yeah.
Dr. Salma.
Yeah, thank you. So management plan, we can explain about the IVF and ICSI and adoption.
Adaption to tell him is not very good now because
Not now,
he's-
but
yes, you can mention at the end.
yeah.
At the end you can mention, but there is a hope for that. There is big hope that once diabetes it will come, and there is hope that with IVF XC technique he can have. Yes, you can give adoption option at the end.
And yeah, do you think that we can elaborate in this case that about the success rate of the IVF or ICSI?
No, please, no, please, no,
No.
please, no,
All right.
no.
Okay.
You-
And NHS fund. NHS will not, there is a fund for NHS or not to give him idea.
If there is criteria for NHS funding, it is very easy criteria for male and female. Okay, there are 2 or 3 things, if not father child before or any living baby died like this, age criteria, smoking criteria. Okay, these or weight criteria. You know all these applied knowledge.
Yeah.
If anything is there, you can touch this point. Otherwise, no need twice unless he asks you. No need to go in. No, you cannot cover 10 minutes. Always there's 10-minute problem. There's a 10-minute problem.
Yeah, and also
You have to cover important point. You have to cover important points first. If you miss diabetic specialist to involve diabetes specialist doctor, endocrinologist doctor. If you did not inform him about this and you take him to NHS funding directly, you will lose marks.
Yeah, of course, we have to mention that one first. But and do you think that to explain the IVF and ICSI little bit to give idea? No need. What is this? How to do it?
For maybe he will ask him. Better ask him. I don't think so here to discuss this NHS funding to promise him. maybe after some, if there is nothing confirmed in this by this data, this case, and not to promise, not to make false promise. This is also very important. This is false promising.
Yeah. So that means to ask only that, do you want me to explain that?
Always go and
about
if he asks you, tell him yes, maybe we can see on commission group, and by GP we can give your name and we'll see the criteria, and to see it's suitable for you, we maybe see for you.
Yeah. No, to explain that about little bit, explain about the ICSI and IVF. So I can ask him that, do you want me to explain, or
yes, if you have enough time, if you have extra time, you can explain.
Yeah, thank you very much.
Okay, any other question? We'll go to case 2. Case 2. Okay, who would like to present case 2? Dear fellows, please don't hesitate.
Can I try, please?
Yes, please introduce yourself.
Yeah, my name is Hashim. This is my first time. I'm from Jordan. Nice to meet
welcome, Hashim. And you will take 2 minutes to read the data. Okay. I will put timer for you, 2 minutes. Once 2 minutes will finish, I will inform you. Then you will enter the cubicle or start your station in Osler, and then you will have 10 minutes. Okay. So I will start your 2 minute data time. Start. Okay, time finish. Enter in cubicle.
Okay. Hello. My name is Dr. Hashim, one of the senior doctor of my consultant in the fertility clinic. May I just confirm your name and age, please?
Yeah, I am John, and I am 34 years old.
I would like me to call you.
Yes, you can call me John.
Okay, John. So, John, I read the GP letter and I see the lab results. Have you had any idea about the results?
No, doctor.
Okay. So I understand that you are here because you are trying to be a father for Farvies. Am I right?
Yes.
So can I ask you a few questions first, please? Then I will discuss with you the results of your test. And accordingly, we will discuss the plan of management. How does it sound for you?
Yeah, okay, doctor.
Okay, so could you please tell me more about your problem from your own words, if you don't mind?
Yeah, doctor, me and my partner, we're trying to have baby for the past 4 years, and my partner seems to be healthy, and but my semen report has been checked twice, and I think there's some problem. I don't know, but they send me here, and I really like to know about my report, and we really like to have baby.
Yes, I understand. So have you ever been treated for this problem before?
No, doctor.
So I understand from the letter that you are a father. So how many kids you have?
No, I have never been father before.
Okay. So, okay. Okay. Do you follow your GP for any medical problems?
No, doctor.
Have you ever had any problems, medical problems during your childhood?
No.
Okay. Have you ever had any surgeries before, even when you are a child?
No.
Okay. Do you use any medications at regular basis?
No.
Even hormones or some supplement?
Yeah, I'm using some injections to get some more muscles in myself. But it's good. I'm healthy now.
So for how long do you use these injections?
Around maybe 1 year or maybe more than.
Okay, do you have idea about its name?
Sorry?
Do you have any idea about the name of these injections?
Yeah, they are well known. These are steroid type of injection. Everybody, because I need to use this.
Yes, I understand. Okay, John, a few questions, please, if you don't mind. I'd like to ask you about your sexual life. Is that okay?
Yeah, okay.
So do you have any problem during having sex?
No, doctor.
Okay, let me to be more precise. Do you have any problem in erection or during or ejaculation?
No, doctor.
Okay, do you have any allergies?
No, doctor.
So do you smoke?
Occasionally.
Do you drink?
Occasionally.
So do you have any trauma or road accident before?
No.
Okay. So what do you do for a living?
I'm a gym trainer, doctor.
Yes, I understand. For how long you are gym trainer?
I'm being gym trainer maybe 2 to 3 years back.
Yes, I understand. So do you have an idea about your height weight ratio, or what we call BMI?
Yeah, it's quite in good control. It is around 28.
Yes, I see. Okay, John, thank you for sharing this information. And I'd like to assure you that all what we will talk now in the clinic will be between you and me, and your records will be confidential, okay? Even your partner will not be able to check your records unless you give permission for that.
Yeah, okay, very good, doctor. Yes.
Yeah.
Yes. I really liked that it should be confidential.
Yes, that's good. Now about the lab results, you underwent 2 lab tests for the semen, and the test usually measure different things, okay? But there is problem that the sperm count is low in both tests. You have low sperm count. I'm sorry to hear that.
What do you mean, doctor?
I mean the number of sperm is below the normal range.
So what does it mean?
Now this means that the number that usually makes somebody to have a baby should be higher than what you have. I mean, the sperm count is low.
So you mean I cannot be a father of baby? We cannot have a baby?
No, the good thing that there is sperm count, but the number is below the average. And the other parameters, including the sperm mobility and its shape, all the other parameters are normal, and this thing is good. Now,
why this, doctor? I am healthy. I'm perfectly fine.
Yes. Actually, according to the information that you gave, there is maybe the cause maybe due to the steroid the injection of steroid that you receive. Actually, there is a link between the steroid and giving low sperm count. But I should order some hormonal test to confirm this finding. For the time being, the steroid that you have may cause this problem. But I should order some hormonal test called FSH, LH hormones related to the production of the sperm, just to make sure that there is no other cause for this problem. Is that okay for you? Or am I clear so far? Yeah.
Yes, doctor, but I can have baby. Me and my partner, we are desperate, so desperate to have baby. What I will do now?
Yes, I understand your concern. Actually, let us start. It's a good idea to stop using steroid injection, okay? And we should wait for a month to see what will happen to the sperm count. So stop the steroid injection, and we will repeat. I will repeat the test after 3 months to see what will happen to the sperm count. Is that okay for you?
Yeah, okay.
Mm-hmm. And of course, for the general advice of lifestyle, such as smoking cessation, will also improve the number of count. Keep going your exercise, but as I said, hold the steroid injection, and as I said, we will order some hormonal tests, and I will follow you up in the clinic to see the result after that. Am I clear so far?
Yeah, okay, doctor.
And of course, don't also, in addition to the lifestyle changes, to having a balanced diet, to be away from the stress, and to have a good multivitamins. This also will help you in achieving the amount, to achieve the sperm count that is good to have at children. Am I clear so far?
Yeah, okay, doctor.
So, do you have any other concern?
So, doctor, once I will stop, you're sure that my sperm count become normal?
No, yes,
if it doesn't happen, what I will do then?
Yes. Now, for the time being, because the lab results showing just you small number of sperm. There's a sperm, a small number, and because you are using this anabolic steroid for long term, the evidence says that this is most likely will be the cause. If this does not happen, and we do what I said just before, after that you will be referred to an IVF clinic for further investigation and assessment. Am I clear?
Okay, doctor.
Now, okay, do you have any further queries?
No, doctor.
Now, your case will be discussed with my consultant and also with the multidisciplinary team in our department, including...
What is this multidisciplinary team, doctor?
Yes, we're a group of physicians, a group of doctors with the nurse, and me and my consultant, and other doctor called andrologist, which is a specialist in male hormones.
Okay, time finished. Time finished.
Okay. Yes.
Okay. Well done, Dr. Hashim. It's a very good attempt. You cover most of the good point in the case, but your information gathering, again, it was more than 4 minutes. Try to cut time. It's must to do information gathering to do in 3 to 4 minutes. Okay. Okay. You took all good points in the information gathering. Very done. Well done. You introduce yourself and you ask situation awareness. Then you ask for medical, surgical, medication. You signpost before the sex life, and you ensure the confidentiality. Very important. Very good point. But you inform, report in a same tone. tone should be changed. Empathy, there must be some empathy. Do some practice. Okay, try to explore by yourself. Try to speak in front of mirror with your study buddy or with your family friends, how to explore. It's not a good news for him. He is trying to have baby, and now you're telling him that he has a sperm count is less than the normal. It is difficult for him to have baby. So it is needs empathy. Okay, so please work on it. Then you discuss about the steroid intake. You give management option to stop the steroid injection, and you further plan to do some hormonal tests. Okay, good. And you were in the last few seconds, you have 1 minute to reassure him, even if that you don't have good amount of sperm appearing, then we can offer you test tube baby. For this we can enroll fertility specialist doctor and an andrologist doctor. Okay, so add this sentence always. Okay, in case this is not confirmed, it is most likely the steroid will be responsible. However, maybe it will not come back easily. Then what, he want to have baby, so you will give some more options. Okay, try to gain marks. Show examiner that you know about other treatment. Show examiner that you have applied knowledge about IVF, ICSI, and this biopsy of testes. Show knowledge about communication with colleagues. Involve fertility specialist doctor, andrologist, embryologist. Okay.
Yes.
Okay.
Yes, I understand.
So I will discuss about the now keys for case 2. Okay, we will follow general template. Okay, already explained before. Medication history, you have to ask specifically any medicine injection, just like Dr. Hashim very nicely asked. Okay, first you will ask about open question, any other medical illness you have. Then specifically you can ask if you suspecting by the data. Okay, then what you do for living is very important. You must not skip this, must not forget this question in any case of subfertility, because mostly there is a steroid or intake or patient you have in the recall. Then address his female partner result. I can see from your case note that your partner all result came as normal. Am I right, Mr. Smith? Mr. John? It shows that you have read the data carefully and you have good presence of mind and you have good grip on station. Okay, you already know that female partner, no need to ask about anything about the female partner. Confidentiality, Dr. Hashim done very nicely. Then explain the report. I'm very sorry to tell you that report is showing your sperm count is less than normal. Repeat test showing further fall in count. However, sperm movement and shapes are normal. Mr. John, it is understandable this news is shocking for you. Mr. John, I can understand how desperately you want to have a baby. If you allow, I will offer you some treatment options for you. Your tone must be changed. Show some empathy. Okay? Otherwise, you will lose marks for communication with patient. Then management option, of course, lifestyle modification, but not to give too much time for lifestyle modification. Make emphasis on stop using anabolic steroid injection. Mr. John, it is very important to you to stop using these injections or tablet as it found to interfere. Give reason why I will do. I am thinking it's good for me. I am so healthy looking. I am so manly looking. Why I will stop using? It is my bread. I'm bread earning from my gym training. If I stop this, I will lose my job. I will lose. If he's a model, he will lose his job. If he's a gym trainer, he will lose his job. It is just taking steroid injection because he want to look very manly or to look very handsome. He will lose his interest. Give reason. Always give reason in RCOG. Nothing is accepted without reason, as it found to interfere with our body hormone system, which are necessary for normal sperm production. Once you stop, it may, you are not sure, it may return to normal. I can check this by a repeat semen analysis in 3 months. Am I clear so far? You give reason, you give emphasis, very important, reason, and you give when to repeat applied knowledge cover. You gain marks for applied knowledge. Even if this not work, am I clear so far? Mr. John, even if this not work and your sperm count remain low, then may need some hormone test called as FSH and LH to see how your gonad working. May need ultrasound to see volume of gonad by spatial ultrasound doctor. Checkup by andrologist doctor who has spatial knowledge about male part and illnesses. Am I clear so far? If count remains low, still there is a hope by test tube baby. For this, I can refer you to fertility specialist doctor. Okay, andrologist doctor, fertility specialist doctor, ultrasound specialist doctor, communication with colleagues. First reassurance, stop injection, first management option. First management option, lifestyle modification. Second and mainstay steroid injection. Even if this not work, we have this another option for you. We are not the loser. We are not some low grade doctors. We have this option for you also. So when he will stand up from his seat from your OPD, he knows that he is oligospermic or azoospermic, but he has 1, 2, 3 options. He will be happy. He has some hope. You're not giving false hope. This is all evidence based. Okay, so you can have test tube baby. In this process, your sperms will be taken out and combined with egg of your own partner, outside a body in lab. May need to involve a specialist doctor, andrologist, and embryologist. Okay, if you don't like to explain, if you see that there is not too much time, you can just stop here to test tube baby. No need to explain this if you have less time. Then you can start like this. Can I offer you test tube baby? For this, I can refer you to a fertility specialist doctor, an embryologist doctor. They can offer you details of the process. No need to explain the detail. Don't expect that no examiner is expecting details. They are 10-minute examination, and you reassure the patient that he can have all details by another specialist doctor. He has reassurance. He will not left untreated or undetailed. He will be seen by another specialist doctor. Am I clear so far? Do you have any question? Empathy from the start till the end. Empathy. Soft, low voice. Doctor, can I go for IUI? This is the question asked in the recall. Okay. Mr. John, it's a good option for those who are unable to do intercourse or have HIV disease, coupled with same-sex partner. However, research and evidence shows not a good option for you, so not recommended for you. Am I clear so far? Nice guideline, the 2017 applied knowledge cover. Maybe he has listened, his family friend, anyone has this IUI. So you clear this, that this is not good for you. This is not option for you. Okay. So now I will write you for some vitamins, refer to diet specialist doctor, another communication with colleague for healthy diet. Counselor, he is very upset. So during the station, he's very upset. He start crying. He's saying, I'm very upset. I'm very upset. Whenever patients say something in role player in RCU exam, they are not saying for none reason. They are saying everything for some reason. If they are saying, I'm very upset, doctor. Oh my God, doctor. Oh my God, doctor, what I will do? I will die. I want to cry. My life will end. We are so desperate to have baby. How can I cannot survive? He need a counselor. Another communication with colleague. Appointment after 3 months you will give to repeat his semen analysis. Okay. Case 2. Any question for case 2?
Yes, I have just a question, please. In the scenario, it was written that he's trying to conceive for 4 years. Or I think it was mentioned secondary infertility. So this is why I asked. Yeah. Yes.
I will check. No.
This is why I asked if that you have babies before. So how many kids? A little bit just.
He may have a miscarriage. Maybe he has a miscarriage with his wife. He's not fathered a child before.
Yeah, sorry,
Okay.
I mean the term secondary infertility for male
Even if
patient.
miscarriage, even yes, even if he has a miscarriage with his female partner.
Yes, exactly. And my point is secondary infertility means not, for example, he has a previous relationship and he has kids from the previous relationship, then he come with another partner. This means secondary infertility for the current partner for the
It
patient.
gives some reassurance that he is not from the beginning. He has a problem. It's just the reassurance giving to the doctor only that something happened between the past 2 years before something happened before the 4 year before it was okay. Okay, Dr. Hashim, are you satisfied?
Yeah, it's clear. Thank you.
Any question further?
No,
Yes.
not for me. Thank you.
Yes, can I ask one question, please?
Yes, please.
The semen, when the rule player asks that about the that normal, completely normal the semen analysis that after stopping the steroid. So can we say that it will be at a maximum 12 months?
Don't give an accurate time. How come you know that 12 months? It is written in guideline. If anything, any figure which is written in guideline, you can give surely.
Okay, so
Okay.
what we can say?
3 months, because by guideline, oligospermia, if not severe abnormality, you will repeat after 3 months. So you will repeat after 3 months, surely. Anything written in the guideline, give the detail. You can give the figure. Otherwise, no need to go in. You will lose mark. Okay, no need to go in a 12 month. You don't know, maybe more than 12 months it will take. We don't know. It is not written anywhere.
But this question is asked before, so we'll do.
What was the question? Yes.
Repeat
what
the
was the question? So you can deal very. You have to deal same what I told you. That Mr. Smith, I cannot guarantee that it will become normal count within 12 months. However, I can assure you that if you do good dietary habits and you stop your injections, it may likely to return normal. And for this, I can check in this after 3 months. But I cannot guarantee give you time, because it is not research based or evidence where it's written that how much time it will take for one after steroid injection to stop, how much time exactly it will take to turn normal. Everybody behaves differently with injection. It will depend upon the time period, how much you are taking and how much quantity you have taken and how much has bad effects already done to your body parts by this injection. My clear so far? He will be satisfied, I'm sure. Are you satisfied with my answer?
Okay, thank you.
Any question?
Doctors, can I ask you one question, please? Is there any rule for IUI, or it should be for restricted person? You mentioned 3 points, but before they were used IUI, before they use for religious factor. Yeah, this one.
The guideline. Whatever, if in the guide, if I am wrong, and in the guideline mention more points than you can mention, but by this guideline, only this point mentioned. Okay.
Yeah, it changes.
Okay, you are in exam. You see, even in the RCOG NHS, so you are in exam, you will only follow guidelines.
Yeah. Okay.
If in the guideline it is mentioned, please mention. You can mention.
Okay, thank you.
Okay, some of the these are the some important cases, however never came in exam. Okay, so these are important but less important. These are some lateral cases. Important cases can came but never came. Okay, try to have good grip on important exam station first, then go for these cases. Okay, these are obstructive causes which is caused by infection, congenital, namely like congenital bilateral absence or vase difference, cystic fibrosis. These two conditions have some prevalence in UK. So If they can ask about obstructed cause, they can ask, but never came for an exam. What we will need to do, we can offer ultrasound of testes to see obstruction. FSH LH usually came normal because there is no central defect, and pituitary and hypothalamus is working fine. Treatment option, PISA, MESA, and GES. You will explain in layman language all options. Okay, I will give you the sentences which you will use. The test tube baby, they will have option. Then role of PGD is here because it is a congenital anomaly, birth defects. It can be transferred. Cystic fibrosis, you will have ICSI. By ICSI, you will give another baby of cystic fibrosis patient. You have a baby of cystic fibrosis. So there's a big role of PGD in such cases. Involve genetic doctor. Non-obstructed causes, Klinefelter syndrome, another important case, but never came before. Already, it can came as already diagnosed case. All came in karyotyping. Okay, general template will apply. Be more empathetic. He is he's different from other males. He's very disheartened. Give him hope for fertility by T's and MTs. In deeper tissue of testes, sperm will be found out under microscope, removed and analyzed by embryologist, an andrologist, spatial doctor of sperm and male part. There's a chance of transfer of same condition. You have this. For this, we will involve genetic specialist doctor. Then you can have test tube baby of your own. For this, we will refer you to fertility specialist doctor. You involve genetic specialist doctor, role of PGD inform, and fertility specialist doctor involves. Hope for fertility. What is T's and MTs? In layman, you know this is detail given in the talk 2013 and 2020. In layman, you will explain, Mr. Smith, even if sperm not coming in semen, there is chance that it will be present in deeper tissue of testes, which can be found out by andrologist, special doctor of male part and system by using advanced microscope. You may be complete sleep or skin will be numb. Once the sperm will be extracted, it will be analyzed by another specialist doctor called as embryologist who has deep knowledge of sperm. Then you can have baby of your own by combining with the egg of your partner by the process called as test tube baby. In this process, another specialist doctor, fertility specialist doctor will be involved. Role of PGT. There is chance of transfer birth defect to your baby. To avoid this, we involve genetic specialist doctor who has knowledge about genes. Donor insemination, adoption has big role in such cases because they have birth defected, they have a spatial condition. Must to mention in these cases that it is another option. What we have to study for male subfertility, TOEIC 2013, TOEIC 2020, nice guideline. If you have enough time, you can go for OGR, but no need. I covered all points, all important points in these sessions. Okay, nothing is left for you. You can save this slide. You have covered 2022 to nice guide. Now question. You will ask question, or I will start asking question, or you will understand everything. Manikam, where are you? Dr. Manikam, please come. Please come forward.
Ma'am.
How are you?
Fine, ma'am.
So any questions so far?
No, ma'am.
Why?
Why? Second one I wanted to present, ma'am, but the doctor he was very advanced, so I lost the chance. Everybody, wherever I go, ma'am, everybody tell you are well aware to everybody. You please be waiting. We will use a new person like that. In all meetings, they are pushing me aside, ma'am. So I wanted to present in your session. Thank you, ma'am.
No problem. No problem. You will get chance in next session. But you understand everything?
Yes, ma'am. I
Any
had a.
question so far? Any question? Please
Ma'am,
ask.
what about
Please
the
do.
client filters, ma'am?
You see this. What is this? You want to ask me this syndrome?
No, ma'am. What is the option in that condition, ma'am? That's what.
Condition. This T's and MT's.
Okay, ma'am.
You can extract. You do biopsy from
Hmm.
needle. You will extract sperm.
Yes, ma'am.
Maybe in the tubules there will be some few even one sperm, few sperm they will found. They will do ICSI. Before
Thank
ICSI,
you.
you have role of PGD.
Okay. After PGD. Okay, ma'am. Thank you, ma'am.
Yes, yes. Must to mention.
Yes.
This is patient safety. You will transfer this syndrome.
The condition.
Yeah, this condition to the baby. You must tell him that this can be transferred. But to avoid this, we can involve genetic specialist doctor. Any questions so far?
It was an
Everybody
excellent
understand?
session, ma'am. Thank you so much. We were
are-
become well informed because
You
of your
all are
hard
very
work.
welcome. You all are very welcome. Any slide you want to save, and so I can put on screen for you. Anybody like to ask anything? Unmute your mic.
Ma'am, can you put send the recording, ma'am, in the group? It is not possible.
You can
Will it be up?
MedExam team. You can request. I can request, and you can request to MedExam.
Yes, ma'am. Can it be uploaded in YouTube? It's very nice
MedExam.
session, ma'am. Yes. So
Yes.
okay, ma'am. I'll ask them. Thank you, ma'am.
Yes. Thank you all of you to join this session, and thank you MedExam team for conducting this session, giving me chance to have interaction for such a lovely candidates, and to have interaction for all you guys. Okay, doc. Thank you so much, Dr. Sabine, Dr. Hu, Dr. Hashim, and all of you.
Thank you, Dr.
Thank you
Mahwish.
very much.
It was a nice lesson. Yeah, thank you.
Yeah.
Thank you so much.
Thank you very much. Very nice explanation, and you.
Thank you,
covered
Dr.
very nicely.
Salma.
Thank you very much.
Okay, wish you best of luck. Okay.